All right.
All right.
This is take two, but I don't think I'm gonna upload the first one because I don't want to upload half of a story. Um, so first we were talking about how hard it is to unsubscribe to to things because we're trying to unsubscribe because we keep getting charged these what we call phantom charges, and we're like, what the heck is that, right? Because it never specifically says what name it is. Like things are under Google Play or newspaper or what something, but so we were trying to figure that out. Anyway, don't fall for the free trial for 30 days, and then it's easy to cancel after that because it's not. They lie.
Exactly.
But what I was talking about, and I
Go for it.
was
Just
already
go for it.
crying. Okay, so I wanted to talk about having a child born with a heart condition, and this might be education for some people, and some people might not want to learn this because there's some graphic details. But okay, so
But everybody should understand
yeah,
what it takes to um, be able to deal with somebody with heart defects.
and I
You know,
think any kind of
multiple
special
levels.
needs too.
Mhm.
You know, there's there's kids born with cancer, there's kids born with like hemophilia, and the cancer comes in all different forms, right? And any kind of even autism and auditory processing and everything, like people are different, and I think, we always say like, oh, back in our day, never have that. You get lickings or you listen or whatever, kids never have ADHD and stuff. And I disagree because I think that everything was there. It's just
We never know.
now, right? Now with medical advancement, we know why people are the way they are.
And science when investigate.
Yeah,
Science can investigate and find out, oh,
yeah,
like, hey, this is a thing and that is a thing.
yeah.
Well, I think for me, only thing I like share with regards to special needs children or people, we just gotta have love and understanding and respect for the fact that people go through shit all the time, and we just need to take a step back and say, okay, we're gonna do whatever we can to help you um, uh, feel safe and feel loved, primarily loved and respected, and we will honor you for what you need. Because you get people walking around, you don't even know that they get heart defects. If you was to see your son walk around, you would never be able to tell that he has a heart defect, and that at any given moment he can just drop dead. You know what I mean?
And that's the thing, even with us, you look at him, everybody, when they find out he has leukemia, huh?
Yep.
Because I mean, so what is leukemia supposed to look like? Right? When they find out I have seizures and myotonia, okay, what is that supposed to look like? What is somebody with seizures supposed to look like? So I used to get that a lot with my son. Oh, they look at him. He looks completely fine on the outside. And people would make comments about, oh, my uncle had heart surgery too when he was like, in his 50s, and he's okay now. He's in his 70s. And I'm like, they go, so your son gonna be fine. Okay.
I'm not talking about.
First of all, if I could flip my son inside out, people would understand. And that's what I always told people because,
So isn't it like related to the lady when you guys in the handicap stall?
yeah, yeah. We were parked at school, and I had the handicap placard, and I went to pick up my son. And she made a comment. She was in the car next to me, and she saw my son get in a car, and he looks completely normal. And she made a comment about, oh, using a handicap stall for, and mind you, she was using a handicap stall when it was her mother's. placard, and her mother was not in the car with her, right? And she was picking up her child, who was
She was a
completely normal.
Karen.
Yes.
Wanted to use her Karenicity.
Yes.
To
And let
snatch
me
your
tell
call.
you, I waited so long for a Karen. I was like, I wish somebody would. Because I was hearing the comments all the time. Oh, your son's running around. Your son looks fine. Oh, your son was just playing with, I'm like, okay, people don't understand. So anyway, this lady, I took my son. I said, Keegan, come here. And I told him, this lady said I shouldn't be parking in the handicap stall for you. Can you show her why we're in the handicap stall? And he lifted up his shirt. You can see where his chest was cut open. You can see, people don't know, but after you have open heart surgery, you have multiple chest tubes. And you can see the scars from the chest tubes. And, so I pointed one by one, I pointed down the line. This is where he had his chest cut open. When he was 6 months old was his first open heart surgery. They cut the chest open, they break the chest bone, right? And they work on your heart. And then they have to put the chest bone back, right? So it's not working on your heart only. It's, you have a broken chest bone that has to heal every single time.
And how many surgeries has he had? So
he's had open, so there's open heart and there's open chest. Woo. Right, so there's difference, but he's had
just a visual image of open chest.
Yeah, and you know what, we've seen it. Okay, so anyway, I went line by line with this lady and I told her graphic details, right? And she just was standing there just like, looking at my son's scars. And I gave it to her and I said, you know what, if you don't know what you're talking about, you should just shut your damn mouth. I said, and why do you have a placard? She goes, well, this is my mother's placard. And I looked in her car and I go, well, your mother must be fucking tiny because I don't see her in here either, And so I was like, I'm legit, because you're supposed to have the handicapped person in the car when you display the placard, right? So I gave it to her anyway. And my son walked back
Lesson
to the car.
learned.
Yeah, shut your mouth, because you never know
Right.
what the person's going through, why they have the handicap.
Yeah, people see me with my handicap placard. They see me get on, and they look, look this big guy, this and that. And
why you have that, right?
Yeah.
And
But
when
they
I
don't know my
had what I
condition.
thought was fibromyalgia, now I know it's myotonia. I couldn't walk very far a lot of times, right? And I had the placard, and people would look at me and they would be like, okay, you look
And
fine.
now with my stroke, that just added to the ability for me to be able to walk far.
Right.
It's crazy.
So you
when you can't breathe.
Yeah. So stop judging. And when your muscles are sore and it feels like you're walking in cement and you have to walk to the store. Yeah. So anyway, my son, he was born 4 pounds 5 ounces.
I think you should detail what his heart looked like or was, you know what I mean, so they understand. You say heart defect, they might think, maybe he's missing one valve or whatever.
Yeah.
Your son's,
or like a hole in the heart. That's it.
Yeah.
Okay, so I first found out when I was pregnant, right? I was on bed rest majority of my pregnancy because I found out I have Rh negative blood. And I didn't know that if you have Rh negative blood, I didn't even know what blood type I was. But when
I don't know what blood type I get.
When you're A negative,
I get Kanaka blood type.
when you have a baby, especially, the baby's blood is dangerous for me. And so my body tries to kick out the baby, thinking it's a danger to my body and like a foreign object kind of thing. So they kept calling it a threatened miscarriage, right? Because I had confirmed pregnancy and then I had bleeding and, I was all confused. So I was on bed rest majority of my pregnancy, but I could always feel the baby moving. And when I was like 6.5 months pregnant, my job shut down. I was still working when I wasn't on bed rest. And, right after that, I noticed one day after I ate, he wasn't moving around. And I just felt something was wrong. So I went to the ER. And they monitored the baby and they said, oh, babies kick. The minimum is if your baby kicks 10 times an hour, your baby is okay. And I knew my son had ADHD while he was in my stomach. Because let me tell you, he was doing tumbles and karate kicks the whole time, right?
He's harassing you.
Yes. So I tried to explain to them, okay, you don't understand. My baby is constantly moving. Not this 10 times an hour, probably like 10 times a minute. And so they said, well, maybe baby's getting bigger, slowing down, whatever, So the lady was just about to unplug. Her hand was on the plug to unplug the machine. And his heart rate, you see the machine and his heart rate dipped like this. And so she let go of the plug and she was like, wait a minute. Did I do that or was that baby? And so she goes, you know what? I'm going to leave you for 20 more minutes. I said, okay. Within the next 20 more minutes, his heart rate dipped again. So she said, okay, that wasn't me, that's baby. Then they decided to keep me overnight, right? And they said, we're going to do an ultrasound. Sometimes the baby's umbilical cord gets wrapped around their neck while they're in there. Sometimes the amniotic fluid that's holding baby is low, for multiple reasons. So they did an ultrasound. Actually, that night, I think, they did an ultrasound. And they said the umbilical cord was not wrapped around his neck. Amniotic fluid looked okay. So they said, we're going to keep you overnight, monitor the baby. Tomorrow, you're going to have a level 2 ultrasound. So that's when I learned there was different levels of ultrasounds. So I'm there doing the ultrasound, right? And so I'm in the hospital worried all night. What's wrong with my baby? What's wrong with my baby, right?
Charlie's right there. Right here.
Yeah, I heard him. So I get the level 2 ultrasound the next day. And, you hear the doctors whispering to the tech, and stuff like that. They're not telling me anything. And at the time, I was with what's now my ex-husband. But at the time, the doctor goes out and talks to him outside of the room, right? And then the doctor leaves. And so my husband at the time comes in. And I'm like, so what? And he just had this look on his face. And he goes, I'll talk to you when we get back to the room. I'm like, oh, hell you're not. You need to tell me now, like, what the fuck is wrong with my baby? And so he said, doctor said that he's probably going to be born with a hole in his heart or possibly half a heart. They couldn't tell because he was inside of me. And that just blew my world apart. I was like, huh? A hole in his heart. Think about that now. A hole in your heart or half a heart. So my first question was, so my baby's dead. Right? Because you think about like people getting gunshot wounds to the heart, right? You have a hole in your heart, you die. You get something and it tears half your heart apart. You die. How can you live with half a heart? So they took me to the room and they gave me medication to stop because apparently I was in labor and I didn't know I was in real labor. And, so they gave me medications to stop the contractions. They put me on complete bed rest. They tried to just have me relax. Yeah. Relax, mom. Just relax. We're taking care of you. Yeah, okay. They monitored the baby, right? And I could only sleep in this one crooked position the entire time because they couldn't catch his heartbeat if I just relaxed and laid down. So the nurses kept trying. Oh, mom, you look so uncomfortable. I'm like, yeah, but if I lay down correctly, I can't. That you won't catch his heartbeat. Every nurse said, let me try. You look so, uncomfortable. So every nurse tried. Bless their heart. No matter what, I had to get back into that crooked position.
What hospital
right?
was?
I was at Kapiolani. And they were really, really good.
Shout out to Kapiolani.
Yeah,
Women's and Children's Hospital.
that was our lifeline here, between here and San Diego. And so, the next day, the doctor comes in and talks to me, and I said, okay, please explain how my baby is still alive with a hole in his heart and possibly half a heart. And, the doctor started explaining to me that there's kids born with heart conditions and blah, blah, blah. And I'm like, I didn't get it. The social worker came that day, gave me a whole bunch of pamphlets, so your child's going to be born with a heart condition, da, 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 da. And all I did was take the pamphlets and throw it in a bag because I didn't want to. I was worried about my baby, right? I just was like praying and praying, please let my baby be born alive. Please let him be okay. So when it came time to, my water bag broke. I thought I was going to give birth then. It was on April Fool's Day. And then they said, no, the baby is the one that makes the amniotic fluid. I didn't know that. So they said, now you're on complete bed rest. Like, I had to go in the bedpan and everything. I couldn't even like lift my body up. So I did that. On the 4th, his heart was in distress. And so they said, all that time, they said, Mom, he's not going to handle, he's not going to tolerate live birth, right? Regular vaginal birth. So we're going to have to do a C-section. I said, okay. So I prepared my whole pregnancy, the rest of my pregnancy, for a C-section. When they were taking me to the OR, like the doctor came in and said, we're going to try and let you give vaginal birth. I was like, boy, you know, it's my first baby, right? I didn't know what to expect. And I'm thinking, okay, you're going to knock me out and cut me and take the baby out, right? It's like a surgery. Now you're telling me I got to push this baby out and worry about my baby. So I'm like, okay, they roll me to the ER. I had the transport team, the resuscitation team. They had specialty OR teams. They had all kinds of specialty doctors there. And they told me 99.9% chance when the baby is born, he's going to have to be medevaced to Rady Children's in San Diego. Okay. And because my water had broken 3 days prior, there's a chance that I'm going to develop an infection. So I couldn't go. And at the time I was like, oh, I wish you would try and stop me from getting on that medevac, you know?
Yeah.
And so it came down to really I couldn't go because I was starting an infection. And so I told my husband at the time, I said, you need to go with baby. And when I gave birth, I couldn't hold the baby because they had to take him straight. I saw him as they walked him by, and they
You
put
couldn't
him
even
in.
kiss him?
I no, because he could die, right? Every second counted. So they had to get him to the ICU. They had to, monitor him and stuff. So I told my husband at the time, I said, you follow our baby. Don't worry about me. You follow our baby and you make sure that he's okay. And so I had him stay with Keegan, and they did whatever they did with me, and I went to a room, and then they had to do whatever because of the infection and stuff. And they said, as soon as you're okay, we'll have them take you in a wheelchair to go see your baby. And I was like, yeah, I'm okay, let's go. I was in so much pain because I had tore down there.
Mm-hmm.
So I was in so much pain, but I was like, I want to see my baby, right? And I still couldn't hold him because he was in the incubator, right? And so I couldn't hold him. And he was in there for a few weeks. And
There's gotta be a way where a mother can touch her child.
he had so many cords and leads and monitors. They even had monitors on his brain and stuff. There was no room to even touch him, barely. And
Oh,
he was 4 pounds, so he's so tiny. And there was all these things on him, and he couldn't move even because I think they had him partially sedated, because if he moves, all the cords are going to get tangled. And so, simple things that seem simple to the hospital, like I dreamed about having my baby, holding my baby, nursing my baby, people coming to visit. Oh my gosh, he's so beautiful, like how you
mm-hmm.
see in the movies. And it was nothing like that at all, right? I couldn't hold my baby, I couldn't touch my baby. They had the gloves that you can put, but that's not skin on skin,
Right.
and I could just touch his feet, and his feet were like this tiny. So that's all. That's why when he was a toddler growing up, that's how he would fall asleep. I would always just touch his feet, because that's all he knew. And So they were watching him, they had to keep him in the warmer because his body temperature wasn't able to be regulated still and all that. There was so many things that went on. And so
He's a tough motherfucker,
uh,
bro.
I didn't nurse,
I love him, bro.
right?
He
He's
thinking
been through a
about
lot.
all the shit that he been through just to get. He's 27 now, yeah.
But I didn't nurse
Amazing.
because I didn't know I could. They said we have to give him a special formula. It has extra calories because he's so tiny, and
We should, okay. We
he
should
could.
dedicate this to Keegan and say, talk about Keegan's song.
Oh yeah, that too.
You know,
That's
I
so,
mean, mommy, it, I'm talking
yeah,
about the
yeah,
song itself that he
yeah,
wrote, but also just his whole life.
yeah.
It should
And I
be
wanted to write a
called
book about his.
Keegan's song.
Yeah,
It's about the
yeah,
song of his life.
yeah. So I found out 3 days after that I could have been nursing, and they could have added the fortifier to my milk, right? And so I started doing that. But because I didn't nurse him from day one, I had started losing milk. And then so I had to redo it. Like, my body had to learn, okay, now you're nursing. I was pumping. And so I was pumping, and I was pumping extra because they said the
Hmm.
more you pump, the more milk and it was sore. But I was pumping extra even if I didn't have anything because I wanted my breasts and my body to realize, hey, you need a baby, you have a baby to feed. And so I would manage to get these little bags of milk, right?
Can I share
And
something
so,
with you?
yeah, what?
I just looked up. What does the name Keegan mean?
I know. Little fiery one.
Yeah.
That's why we named him that.
Oh.
Because he was always in my stomach like
So
that,
Irish origin.
Yeah. Yeah, it's
Okay.
Gaelic, yeah. So that's why we named him that because he was always moving. That's why when I went to the hospital and the nurse tells me, oh, he kicked 10 times a minute, I'm like,
Yeah.
you just don't know, right? And so so when once I started nursing, pumping, and once he was able to come home, they told us, at any time be prepared for him to be have have to go straight to Rady Children's for his first open heart surgery. So every month we went for a checkup, and every month the doctor said, okay, he's okay for right now, just keep me posted. And I mean, when you take your baby home, you think of all these wonderful things. First of all, we couldn't have people come visit because the common cold or any bacteria could kill him, right? So nobody could come see him. We had exceptions, but we had to tell everybody, please don't touch baby, right? And so we had family and friends tell us, oh, they're just paranoid first time parents. You know, you're going to learn fast that, babies got to play in the mud and babies got to dig their nose, that kind of stuff, to build immunity. And I'm just like, okay, you guys don't understand. And we tried our best to educate our family and friends. And people just didn't understand, right? Because it's not their baby. And he looked normal.
Yeah.
He looked normal, except he was tiny. And so um, every day, just nursing him, he would be too tired to nurse completely, right? Because his heart works 4 times harder than the normal person's heart. Just sitting up, just breathing, just doing that, whether it's using the bathroom and wiping his butt, like 4 times harder. It doesn't matter what he's doing. And so, month by month, we went to the doctor. When he turned 6 months, or like the 5th month mark, they said, I think it's time to go. So we made preparations, went to San Diego. We had no idea that there was other families, support around with their babies and stuff. Even though we had been going to a pediatric cardiologist, I had no idea that these other kids, babies walking around and carried around, were actually heart kids. So we went to San Diego, and that's the first time when he was 6 months old that we learned that there was a support group in Hawaii. Okay. So we went there, a family that had similar condition to Keegan, except it was opposite sides of the heart that was defected. Um, they took us under their wing. Oh, okay. So the day after he was born, he was actually ambulanced over to Queens because they had a cath lab there. And so I had my husband go at the time. And they did like what they did with you. They stuck the catheter inside and they went up to his heart and they checked what he had. And so they said they could narrow it down to 2 different defects because it was still hard to see. He was tiny. And they said, we think what your son has is tetralogy of Fallot and pulmonary atresia. Now, tetralogy of Fallot is a 4-part defect. That means he's got 4 defects in one heart, as it is. And pulmonary atresia is another one. So of the 4, he had 3 of the 4 in tetralogy of Fallot. And so basically with all his conditions, he had a whole, like your heart, I had to learn this. Your heart has 4 chambers, 2 top and 2 on the bottom. The top is called the atrial, and the bottom is ventricular, right? The ventricle and the atrium. So there's a wall that separates the 2 sides of the atrium. There's a hole in the top part of his wall, which he still has till today. Because if they close it, his heart's gonna be under too much pressure and he'll die. The ventricle is bigger in your heart, the bottom part, and the wall, 90% of the wall was missing, right? The pulmonary atresia.
So you're saying that almost the entirety of that wall was gone.
Yeah. So that's why I guess when they seen it, it looked like he had half a heart because the blood flow, the way it was flowing and stuff, it looked like only half. And then he had his walls were thickened. That's another part of the tetralogy. And the pulmonary atresia, so on the top of your heart, you have a pulmonary artery that takes blood and oxygen from the heart to the lungs. He didn't have that, right? It was missing. And so what happened was, instead of having that, his heart grew a bunch of tiny arteries so that he would get oxygen and blood flow through the heart.
That's amazing.
Right? Even the doctor was shocked. But when he was a toddler, that's what prevented him from getting as much as he could or as far as he could with the condition he had. Because his first open heart surgery, what they had to do was they cut open each of those tiny arteries. So all of them, I don't know how many there were, but they cut them open and they connected them all together to make a pulmonary artery, one big artery, right? And it was amazing because his first open heart surgery was 8.5 hours long. Your heart is the size of your fist. My son's fist was probably like this tiny, right? Can you imagine a surgeon cutting that open and working on all the little arteries, right? 8.5 hours.
The tiny itty bitty.
Yeah.
It's like, almost like strands of
like
hair.
Like string, yeah. You know, but they did it, right? So he came out and something happened during surgery to where he needed to be on ECMO. And the ECMO,
what is that?
So it's a machine that helps the heart, and that was a life-saving machine, but they only had it in the PICU, not the NICU, right? So the PICU is older babies, right? It's pediatric intensive care unit. The NICU is neonatal. And so he had to go in the PICU, and
so they had to transport him to.
It's a different part of the hospital, but they had or maybe it was opposite. He had to go into the NICU. I don't remember. It was like, but so he had to be on that special machine. The doctor came to our hotel the next day. He drew on a piece of paper what the normal heart looks like. I mean, this is, chamber is here, the artery goes here, and all that. He goes, your son, this is what his heart looked like. And he drew it. I mean, down to he had a kinked artery here, he had one artery going the wrong way, he had all these things. And I looked at that and I was like,
They were like noodles.
yeah, but I was amazed, right? So couple years later, he had another angiogram, and with that, you can see where the blood flows is, so you can see where the arteries are.
Mm-hmm.
I compared it to the drawing, and it was exactly the same.
Wow.
I was amazed at the surgeon, right?
Yeah. So the changes was made back to like look almost like normal.
No, well, so no, they can't make his heart look normal or even function normal because some of the defects, no
No,
matter
so
what you
in the
do.
drawing, what drawing you was amazed they look exactly the same, the old or the new?
Well, they
The
were
original, I mean, what a normal heart
the
looks
old
like,
one,
and
because they compared the angiogram right to
right.
what it looks like now. So they gave us a picture of the old angiogram,
Mm-hmm.
right? That they took, I guess, the same time he did open heart surgery.
Right.
And so the
Also,
new one
his drawing, his
was
rendering of
exact.
that.
Yeah,
Right.
was exactly of how they did that. And he just came to the hotel and drew it, right?
He knows his stuff.
Yeah. And so
What's the name of the doctor?
Dr. John Lamberti. Yeah. He's awesome. He's moved on to Stanford, and I believe he's retired now. He's actually retired. But so that was all. Like, if you can imagine, this is all 6 months, and this is not including like the tedious day-to-day things, that even when he cried, like babies cry, right? He had a weak cry, and even crying weak, he exhausted himself, right? He couldn't, that took too much energy. And so, moving his arms and stuff like infants do, that exhausted him. So that's 6 months, right? He had his first open heart surgery. Then he stayed in the ICU for a while. We couldn't stay with him. No, by then we could touch him, but when he was in the he was in the ICU, we could only touch his arm and stuff, but we couldn't stay there with him, right? Because they had other babies. It was more like those baby where you put the newborns and stuff, and then there was another baby here, another baby here. So because of privacy, they couldn't, and they had one room that was an enclosed room, and I learned after that that's the room that they put families in when they know the babies are gonna die, because that way they give privacy and they can, say goodbye. And when the baby does pass, they can spend time with the baby before they take the baby away, right? So every time we get to know the families there and their babies, oh, how is he doing today? I know he's doing better. And literally, the baby next to Keegan, I would talk to the mom and dad, and they would talk to us about Keegan, and the baby was fine. Baby was fine. Baby was getting better. We came the next day, and I started crying because the cradle was empty. And I asked the nurse, where the family went, and she said they're in the room. I was just like, the baby was fine yesterday. Like,
so the goal is not to get to that room.
Yeah, I was like, first I wanted to be in that room because I was like, I want a private room, so I could be with my baby. Then when I learned what the room was, I was like, okay, I don't want the room. I don't want the room. And so, when, and I didn't realize, okay, so the family that took us under their wing, he was normal until he was like 18 months old. When we got there for Keegan's first surgery, they were there for his second surgery. He was normal when he went in for that second surgery. He had gone in 2 weeks prior to Keegan. And they closed his chest after surgery. And the kind of surgery he had, the heart and lungs swell after surgery. And he ended up going into cardiac arrest. And he ended up pretty much like almost like a vegetable. He could hear you. He couldn't respond. His muscles got stuck like this. He couldn't move. He couldn't speak anymore, but that family took us under their wing. And I found out after that, wait a minute, when you came up here for this trip, he was running around. I didn't realize that, And he lived till he was, I think, 20, 21, like that, in a wheelchair, couldn't move, couldn't talk, nothing.
So they learn, the medical learn that
Yeah.
you cannot just close up the chest
So
cavity.
Keegan had pretty much the same surgery that Jaren had 2 weeks later. And so they learned from his surgery. So when he was born, I didn't even realize, because they have everything bandaged and all these things and tubes coming out. And the doctor came in and talked to us one day, and he said, and the nurses are telling us not to touch over here. And I didn't know why. I figured, oh, yeah, because it was just cut open. And the doctor said, after so many days, I think he's okay. We're going to take him in and close the chest. And I went, huh? What do you mean close the chest? And he said, well, we couldn't close it. That's when they explained, right? Because the heart and lungs swell after surgery, and we had to let it swell, and then we had to let it subside so that we can close his chest safely. So then I looked at the bandage and I noticed that it was like this. So this much of his body was open. Like literally, if you had taken off the bandages, you would see it wasn't even stitched. It was open. His heart was right there, right? So they took him and
That's
closed
interesting.
it.
So there's two different instances where Keegan's life was spared. One was with the melody valve, right?
And that was later.
The
Yeah.
doctors learned to just to his sister
Yeah.
what not to do, right?
Right.
Or
Well,
what to do.
yeah, it was just more how the body accepted it.
Right.
Hers didn't accept it. It didn't work for hers.
But so that taught them how to deal with Keegan.
I don't know if they did something different in that situation. It's just the
And then-
melody valve was the newest thing, the newest technology. They had the melody valve in adults, but it wasn't approved for pediatrics. But they tried it because that was like, it was life or death at that point, right? So they tried it before having an emergency transplant. And so yeah, so his that first time was not closing the chest, right? And so once they closed the chest, then I realized, wow, yeah, my son looks a lot different, right?
And so the second one with the chest,
With
the doctors learn gotta leave the chest
right,
open.
that was the first one. His melody valve was
The
later.
second.
But it's like
So it was an experiment.
Yeah.
All the way
And
through.
you know what? All the kids kind of are, because technology is advancing constantly. And every kid responds differently to the procedure. So, they
So
have to adapt.
In that field alone,
Yeah.
in that field alone, nobody should assume that you can run a cookie cutter process.
Yeah, no. You can have the exact same condition, exact same thing. And one will have their surgery, they both have their surgery on the same day. One will live and to have a normal life, one will die. Or one, the surgery goes okay, but the function of the heart will never be, normal, can never do the same things. Because there's kids with Keegan's condition that are living normal life. They can work, they can drive, they can, hike a mountain, they can do all kinds of stuff. But then when you talk to his surgeon, Keegan's is severe, and his is, no matter what they do, he will never be able to be normal, right? And so he was in the ICU for
I see him as pretty normal.
a month. Yeah. He was in there
Because he
for a
makes so
month.
much trouble to his money.
Yeah. But we couldn't see him, but we could visit him for 5 minutes every hour. So Jay and I slept in the waiting room every day, all day. And when we did have to go back to the Ronald McDonald House at the time, we went to shower and we would come back before the 5 minutes that we could see him, right?
How far was
It was right across the street. But, you know, it's like you don't want to leave, right? And then one day I was visiting him, and it was only one parent at a time at some point. So I would go visit him for a couple minutes, and then Jay would go visit him, right? Because we had to stay within that 5 minutes. And so I was visiting him and I was seeing him, and he was agitated that day. And probably because he was coming out of sedation more and he was uncomfortable with all the things, right? He still had a breathing tube in him and all that. And so the nurse is like, yeah, he's coming off his sedation. We're letting it slowly, you know, come out so he can be more alert. And he's a little bit agitated today. That's normal. And I was talking to the nurse, right? And I looked at him and he started turning colors. He was white, then he started turning a little bit musky looking. Then he started turning more gray. And I'm looking at his monitor, and his oxygen saturation started dropping a little bit. So when he was around like the 70s and 60s, he started turning blue and purple.
Boy.
And it was just going down, going down, going down. And so the nurses came, and then they were watching it. And when his oxygen saturation hit 30s, he was black. He's black. I mean, and I was watching him die, you know, because your oxygen saturation gets to zero.
Why didn't they do nothing?
No, they were, but it was still dropping, and so they were trying to. Everybody was around his bed doing emergency. So I stepped back to let them do their thing. But once it got to like 30s and 20s, they asked me, "Mom, can you step outside, please, for a minute?" Right, to let the doctors do their thing. And I thought, I'm gonna step outside and I'm gonna come back. My baby's gonna be dead, right? So I stepped outside. After about 15 minutes, I think, they came and they said, okay, he's okay now. You know, you can come back in. And I just was like, what happened? And these are the little things that can happen with the heart when the heart's not working well, right? It can be fine, and then in an instant, it can just, you know, go haywire. And so he got through that experience. You know, he got transferred into like a, you know, more like a high, you're not in, well, he went from there to a normal critical care unit, and then from the critical care unit he went into another unit that was like your stepping stone before you get discharged. Then we had to stay at the Ronald McDonald House for a couple more weeks while he had post-op checkups, and especially because of families that have to fly back to Hawaii too. Once you're on the plane, you know, there's no turning around within a few minutes just to, you know, do medical treatment. So they had to make sure he was okay to fly back. So we come home. Of course, everybody wants to see him, you know, and I have videos of him in the hospital with his stitched chest, you know, and all his tubes. And I took video, and most of our friends and families couldn't watch it, you know, because they watch like 5 seconds of it and they start breaking down. And I took video mostly because I wanted one day for him to see those videos, to see what he has overcome, right? If he had survived that, because the doctors told me they couldn't promise me that my son was going to live to see his first birthday. And so every day was a gift, right? And he continued to, you know, get better
took pictures of
as we came home. And of course, on the outside, you know, you put the baby clothes on, he looks perfectly normal. You know, he can smile, he can, you know, laugh. So everybody would get the comments, you know, oh, they're just first-time parents. You know, he had his surgery already. You know, what are they paranoid about? You know, I'm just like, okay, you know. So we ended up kind of, I think, being separate from the world, because nobody understood, right? Nobody could understand. You weren't with us 24/7. You don't know that every little thing affects his heart. You don't understand that. You have a normal child, you know,
right.
That's fine. You know, I don't want to be around your normal child because you're going to compare your normal child to mine. So when I came back, we learned that there was a support group, and we started, you know, hooking up with them. And the first support group I went to, the first meeting, nobody brought their kids, and everybody, it was like a depressing meeting because
It's like an
everybody's
AANA meeting.
yeah, and it was really like dark, and we brought our
Mm.
baby, right? And everyone just looked at him like he was doing great, right? And I felt so bad because everybody else's kids was, oh, he can't do this and he doesn't do that, and he's supposed to, and I'm just like, okay, but he's alive, right? Like, he's alive. You can love him up today, or her, you know. So as I got more involved, I started changing the group, and I was like, we need to bring our kids. We need to bring our kids. It's a support group, not just for the families, but we need to bring our kids, so that's part of the support for each other, is seeing that there's other kids like our kid, right? And that grew,
It's like a family. It's
yeah,
to coalesce
and
as
it
a family.
really became a big family. And eventually, when I took over I developed a mentor group, and then we started taking
called?
the kids, cardiac kids. And so, and that's like a whole nother, probably episode. But
Who, like, you guys had sponsors and whatnot for cardiac kids? What kind of
no, I mean,
support
the
from?
hospital gave us a conference room to have our meetings for free, but other than, they provided like some snacks and stuff for our meetings, but it was mostly the families that, were able to like
You guys wasn't able
get
to get
together.
events put together and
So we did. We had a Valentine's Day, because it's the heart. We celebrated our heart kids and stuff like that. So I think that's part of, like, the mentor group and
But
all
what
that.
about like joining forces with other organizations to help promote that?
There's no, like, okay, Keegan's done a lot with American Heart Association. They're great. But American Heart Association is all research. That's what they do, is research, right? So it's great that the monies go to research, and they're doing a good job. But also, I learned the research that they do is mostly like, your grandpa has a heart attack. So there's a difference between congenital heart conditions and acquired heart conditions. Acquired heart conditions is when your uncle or your auntie or your grandma and grandpa get old, and people get heart issues, right? And yes, they have bypass, double bypass, triple bypass. Yes, there's extensive heart issues with adults. Pediatric, when you're congenital heart conditions, when you're born with a heart condition, the way you go about treating it is completely different. And so are the doctors. The doctors have to go to extra schooling and specialize in pediatric heart conditions. So if I took my son to a regular cardiac doctor here, they don't know what to do, right? And so um and that will lead me to um another thing towards the ending. But okay, so growing up with Keegan, right? um when he was 5, kindergarten, now you think about it, it's a milestone for kids, right? They're excited to take their kids to kindergarten.
I remember kindergarten.
Yeah,
I remember we used to we go plant the lima bean
Yeah,
seed in
that's
a
the kind
milk
of stuff they do,
carton
right?
and watch that.
So all of those things, my son missed 3/4 of his kindergarten year, because when he was 5 and he went for a dental procedure, and you can't even go for a clean or a checkup without getting antibiotics prior to protect your heart, and antibiotics after. It can't touch anything, because any bacteria, any infection goes straight to your heart, and he can die. So because he had extensive work that needed to be done, they did him in the OR. And a lot of people don't even fathom that. Like, it's just pulling teeth, like, why do you need to go to the OR? Because they needed to monitor his heart, they needed to monitor his oxygen level. They gave him oxygen while he was under. So it's like having a heart procedure plus a dental procedure, right? So he came out of the dental procedure. The dentist said, everything went okay, the normal, he's gonna be in recovery for an hour or whatever, and then he can go home. drink apple juice, whatever, go home. Right before they were gonna they were gonna transfer us to another area because they needed that specific bed for someone coming out of the OR. Right before they were gonna transfer him, they actually lifted him up, and his body curled and he went into a seizure, right? And he was unplugged from the machines because they were going to transfer him to the other section. And the nurse was like, what the heck? So she ran to get him in the other bed. She put him down and she was like, I think he's having a seizure. So they were rushing to hook him up to everything. And then he came out of it. And then, of course, he started crying because he was like, what happened? They put him on the monitor. And it was Queens, so they didn't specialize in pediatrics. So the blood pressure cuff, they ran all over the hospital finding the tiniest one they could. And even that was too big for him because he was little, right, at 5 years old. And so, I mean, he was 11 pounds at 6 months old. So when he was 5, he was still tiny. And so they, you see the heart rate like this on the monitor, right? And I was talking to him and I was like, I looked at him and I'm talking to him and his head happened to drop into my hand. And I was like, Keegan. And I lifted his head up and I looked at his monitor and his monitor went from this to flatline, right? And when you see somebody's heart flatline, right, that means they're dead, right? Mm-hmm. So the nurses come rushing, and it only happened for like a few seconds. And so then we started realizing that, okay, like every time his heart would do this, and his heart started flatlining and he's looking at me. And I'm like, looking at the monitor, looking at him. I'm like, Keegan, are you okay? And he goes, yeah. And then all of a sudden he would drop, right? And so they were on the phone with Kapiolani because Queens didn't know what to do with him, right? He needed to be at Kapiolani. So they were on the phone with him. Hawaii has what's called Heart Week, and it happens 4 to 5 times a year, where the surgeons from the mainland, and it happened to be Rady Children's, where my son was, they come to Hawaii, and within that 1 week, they schedule pediatrics that need heart surgery that are a little bit more complicated, but don't have to fly to San Diego to get their surgery. So they do that during Heart Week. And it was a Friday, and usually the surgeon, after the last surgery, he catches the flight back to San Diego. So it was the afternoon, probably about 2 o'clock or so. They were on the phone with Kapiolani. They said, we're trying to figure out what to do. We're trying to get an ambulance to come get him, to take him to Kapiolani. The nurse comes up to me and says, okay, so the dentist is talking to a Dr. Lamberti. She couldn't, and I said, Lamberti? And she goes, yeah, that's the one. And I said, oh my God, it must be Heart Week, right? It happened to be the Friday, the last day of Heart Week. And so they transferred him by ambulance. We get there and the surgeon tells me we need to do an emergency pacemaker surgery.
Is the first time they gotta do pacemaker for him?
That was the first time. And you know what? When they told us that he was going to be born with tetralogy of Fallot and pulmonary atresia, the classic, like you said, cookie cutter thing is when they're this much old, they have this. When they're this many years old, they have this. Okay, he had already bypassed that because when he was 18 months, he wasn't supposed to have a surgery yet, but when he was 18 months, he just happened to have roseola, which we thought was chickenpox. Went to the ER. Because he's a heart kid, the standard is they do a chest x-ray. The doctor tells us, oh, when I looked at his past x-rays, it happens to be like, it looks like his heart is growing, right? And I'm like, what does that mean?
No, but what is
like a swelling.
How to do with roseola?
So we just happened to go because he broke out in this rash.
Oh. Okay.
So they said, oh, he has
like,
roseola. Yeah,
roseola
but because you go, that's like when you go for something like that, even if you have a rash and it's hives, if he's a heart kid, standard protocol is chest x-ray, EKG, blood test, right? That's the standard to see if anything else is going on with his heart. So that doctor just happened to notice that. And so he said, you should call your cardiologist tomorrow and see if you can visit. So I called the cardiologist. I'm like, all this time he's been taking x-rays every month. Nobody said anything. Cardiologist calls me after he looks at the x-rays and he goes, yeah, so, there seems to be a progression in his heart. I called San Diego and, you don't have to fly out tonight, but San Diego is recommending that you fly out ASAP. Real calm like that. And I'm sitting there going, huh?
Going right now.
Yeah, I was
Fire
like,
drill.
so I called,
Okay,
but they have
crazy?
to get the hospital and everything prepped, right? So I called the lady in San Diego and I was like, they're telling us to come, ASAP. And she goes, yeah, okay. She goes, I'm gonna get you guys out on the first flight tomorrow, right? That's the best they could do, right? So we get there when he's 18 months old. That was an extra surgery that wasn't in the schedule, for kids with his condition. They said he had a pseudoaneurysm. They didn't know it was a pseudoaneurysm. When they're telling me aneurysm, I'm like, all I know is people have aneurysm, it bursts and they die, right? So here we go again. We get there and the doctor does a cath first before the surgery, and the doctor pulled out. He comes, the doctor comes out, and we got to know him. He comes out and he goes, so I'm gonna let the surgeon handle it tomorrow, because I went in there and he said, I've never seen this before in my life. His aneurysm was pulsating with his heartbeat. He goes, so I went in there and I was like, nope, pulling out. I don't know what the hell that is, but I'm not touching it, And so he ended up having a surgery the next day. And that's the time that the doctor had told us, I need to have a really serious
Keegan,
talk with you.
He created a lot of trouble.
I'm telling
everybody.
you, that's
He
why they know.
harasses everybody.
That's why they know his name. If his name shows up on the roster, they clear everything out because they know nothing goes the same with him. So this doctor came
He's a
out,
special guy.
and they said that
He's our special guy.
when he was doing a surgery, and I didn't realize this until later, right? That when they did the surgery, he said his heart deflated and they manually had to get his heart going again. Okay, I didn't know what that meant, right? Because I was like,
tie a pump again.
right? I was like, so he's okay, right? And he goes, yeah, he's okay now. I didn't realize what that meant until years later. His heart stopped. When they said they manually had to get his heart, they had to give him compressions. His heart stopped, right? So, okay, years later, I saw something on TV, and then that's what they said. Manually, we had to get together, and they're doing compressions, and I cried. I was like, oh my God, that's what he meant. So anyway, that doctor sat us down, and he said, we need to put him on this medicine called digoxin, right? And it's a heart failure medication, right? He was 18 months old. It's a heart failure medication. I need to tell you the pros and cons. We have no choice but to put him on this or he'll die. But the cons about that is, he said, you have to understand, he probably will never be able to get off of it once he's on it because his heart needs it. But you have to think of it as, we're forcing his heart to pump. We're forcing his overworked heart that works 4 times harder just to survive to pump harder, right? So he said, I need you to understand that this medicine has
so how's
to
the
be
wear
taken.
and tear on the heart then?
Right. So he said, he stressed to us that this even more so could shorten his life, right? Because
what was that he was
more
on?
stress, digoxin.
Is he still on that?
Yes. He can never get off of that because it's heart failure medication, right?
Oh.
So that happened at 18 months. Then we had the pacemaker, which was
He's 27
never
now.
talked about. Yeah. He's old. He's an old heart kid. They don't, a lot of them don't survive like that, right? And so, the pacemaker was never talked about. That was like, they said maybe in his teenage years. He was 5, right? So I'm like, and I was nursing my daughter at the time. She was 6 weeks preemie, 3 weeks old. And I was nursing her at the time, and he's in the ICU at Kapiolani. I felt like a robot, like a machine. I would nurse her, pass her over to family in the waiting room, go in and stay with Keegan, they would call me and say, your daughter's hungry again. I would go out, nurse her again, pass her off, you know. So, and so he got through the pacemaker surgery. The surgeon actually rescheduled his flight and stayed later for Keegan because he's the one that did his first 8.5 hour surgery, and he knew his body. And so he did the pacemaker. And then after that, there was a period where Keegan was going to San Diego every 6 months because he needed a procedure done, whether it was an open heart, open chest, or a cath. He needed a procedure done because his arteries are so small, and they would put stents in it, and they would have to open up the stents because you know how I said for your brain it takes 6 months for your body tissue to grow?
Mm-hmm.
Well, his body tissue didn't stop. It kept growing and growing. So now his artery that they opened up with the stent is back down to this. And some of them were completely closed because his body tissue just kept growing and growing until it's closed completely.
Wow.
Right? So they had to push through that and open it up again. So he's going every 6 months, right? Now, okay, so he would go under anesthesia every 6 months. He would have night terrors for 6 months. And right before his next procedure, he would start to get over the night terrors, right? Every single night he would have night terrors. Every single night he went to sleep, he would wake up crying. He wasn't in his right mind, like how you kind of had when you first came out. Every single night. Sometimes at the age he was walking, he would be walking around, but he's not completely awake, right?
Yeah.
So we had to make sure he was safe in bed, and we had to like stay with him and make sure that he didn't hurt himself and all that. And we found out years later, because every time he would go to surgery or some kind of procedure again, his night terrors would start all over again, right? And we found out later that it all had to do with when he goes under anesthesia. When he explained it, he said, you know, when you get the gas, you feel kind of loopy. Then they put the mask on you, and there's more gas in there, and you get more loopy. But right before you go under anesthesia, there's a darkness that comes down on you, and it just, once you get completely, the hole closes, you're out, right? And so he feels like he died every time. And that control, that he never had control over when he could have surgery, what they did, what the outcome was, you know, that whole control taking over. That's why he would have night terrors, right? So then growing up for him was never easy. I mean, people think, okay, you fix the heart, you physically repair the heart, everything's all good. There's so much trauma that goes on. And then he was diagnosed with ADHD on top of that. He was diagnosed with epilepsy on top of that. He, you know, just all these other things coming into play.
And what, I wonder what went through his mind the first time he ever saw his chest open.
No, because if the chest is open,
He got to be out.
he's got to be out, yeah, because
What
he can't
about when
even
he's
move.
healing?
Oh, when he's healing, yeah, he sees his chest and he sees.
No, I mean, because at some point they cannot put the chest back until the heart.
Yeah, so the whole time it's open, he's got to be out where he can't move.
Oh, okay.
But once they close it and they do the surgery, then they start letting him come out, but he can't,
it was
you know,
long
move.
time then under anesthesia.
Oh yeah, well, it's a sedation, right? It goes from regular anesthesia to like a strong sedation, and when they got to keep giving it to him, right, to keep him under sedation.
So it's like hours, days.
So
it's like almost like a coma, like.
Yeah, because they can't have him move at all. Like one twitch can, you know, your whole body is screwed up. But you know, so nothing. Yeah, yeah. And so
Grateful you never had a seizure.
And I think under sedation like that, I think you don't have seizures, you know. And he wasn't diagnosed with that until after. And what's funny was, I saw him have a seizure at one of his trips. He was like, I don't know, maybe 3. I saw him have a seizure in the hospital in San Diego, but it didn't affect any of his monitors. but I physically seen it, and I called the nurse and I told her what I saw, and because she didn't see it and it didn't affect his monitors, they didn't note it down as a seizure, right? And he had never been diagnosed with that. Fast forward a couple years later, when he was actually diagnosed with that, I saw the same thing. And so he did have a seizure that time. And it has everything to do with when you're in open heart surgery, you're on a machine. Your heart is technically stopped. They have to stop your heart. And there's a machine that's hooked up to pump blood and because you can't work on a heart if it's pumping, right? So they have to stop your heart. And all the machine does is make sure there's
like the
oxygen and blood flow going through, but it's a stopped heart that they're working on. And they hope, because you don't know, that when they're done with the surgery and they turn off the machine, that the heart will start pumping by itself.
Wow.
Right? You can never tell. And so, you know,
Damn,
all these little things that you don't realize.
That's a lot of shit that goes into
right,
it.
That goes
and
along
this is
with
27 years, you guys.
Right. And so, you know, once he became like, there was a point where he was too tired to do things, and I refused to let him just be home and not do anything, right? So I was like, okay, you know what, get in a wheelchair, I'll push you in a wheelchair. You want to go to the park, we're going to go to the park. You want to go to a carnival, we're going to go to the carnival. And so we tried very hard to make life fun for him, right? Every surgery that we went to in San Diego after, we would take him to Disneyland, you know. Then we learned,
I never been to Disneyland.
I would take you. But then we learned to take him to Disneyland first, because he was always sore and, you know, not being able to enjoy Disneyland after, right? So we took him first. But, you know, then once, as he started getting older in his teenage years, you know, maybe like 15 to 18, he started slowing down. But he's, you know, by then taking care of himself, right? He knew all his medications, which is like, at one point he was on 15 medications a day. And, you know, as an infant, you go from syringe medications, 7 or 8 different syringes, to all pills, right? And by then he had been able to take it himself. He knew what he was on. He knew why he was taking all the medications, because they taught him all of that. And, but just the everyday living, because I no longer was physically having to change his clothes or do anything. He was doing that on his own, right? I every once in a while would check in on him and say, hey, how are you doing? And he would explain to me, yeah, Mom, today I had energy, you know, but today I had energy, but tomorrow I'm gonna be tired, I know already. He would start telling me, and then he would have spurts of energy. He's like, you know, so and so wants to come over and play video games. Okay, you play video games for 3 hours, because he would always push himself to do things that he wanted to enjoy. But after he does that for 3 hours, he can't even brush his teeth, you know, that he's just so exhausted. But we would let him do that because I wanted him to enjoy every day, because you don't know when, you know, it's gonna be his last time. And so then once he turned 18, I wanted to treat him like a normal adult, right? And I was like, okay, you're an adult. You need to now control everything, right? You need to communicate with the doctors. And at that point too, they don't let mommy or daddy come in. Your son's 18, you know, like, I mean, with their permission, with his permission, we could be involved. And luckily he had good doctors, but he was able to go in on his own and decide things. And so, you know, I take for granted too now when he's 27 that, you know, I see him walking around, I see him doing things like on the land, right? He'll go hike with Trinity up the mountain and stuff. And I take for granted that he's still pushing himself to do those things that he has fun with. And he told me the other day, which kind of made me tear up a little bit, is he said Nathan wants to go out to celebrate Nathan's birthday, right? And he said, I was supposed to go with him like a couple weeks ago, but then I got sick, right? He got the colitis. And then he said I wasn't feeling well this week. So we tried again. And so I made the comment to him. I said, wait, you're willing to go out with Nathan for the night, but you won't go out with us, and stuff. And he goes, well, we've been trying to go out for the last 4 years. And I'm trying to do this for Nathan, right? And I go, what do you mean 4 years? And he goes, yeah, Nathan's been wanting to go out with me and celebrate one of his birthdays for 4 years. And he goes, but things kept happening. I either didn't have enough energy, then Makana died, and all this stuff, and one thing after another. And he goes, but, lately we've been talking about how old we are and stuff. And so I really want to make it a point to do that, right? And he goes, Nathan was like, wow, you really don't have energy. Like it was flipped when they were kids. Nathan was the sicker one, and Keegan had more energy. And then at one point in Keegan's condition, he became the one that no energy, and Nathan can go doing hikes and all kinds of stuff, right? He drives, all that. He works. And so Nathan made that
was
comment.
a really good moment, and we saw him come drive down to us when we were selling our food.
Right. And that's something that, a lot of our heart kids like Keegan can't get to. And so Keegan said, I had to think about that, right? And I was like, he goes, I gotta go out and I gotta do it, and Nathan goes, yeah, he goes, maybe I'll come over, and this and that. And Keegan goes, Nathan, you realize that when you come over and visit for 3 hours, I'm exhausted for like a week after? And he goes, oh, I didn't know that, and he goes, well, how come you don't say anything?
He looked at him, Keegan looks at him as a brother, and Nathan looks at him as a brother.
And I think both of them know that
Keegan
either
is older,
one of them, they can die. Keegan is older, yeah. But either one of them, tomorrow's not promised, right? So that's how Keegan has been all his life. Like, he'll be tired, like when he chops wood, right? That's something he never thought he would be doing, right? To him, it's like out in the woods,
I
chopping
like seeing
wood.
him when he do that.
I do too. And he pushes himself to do that because he enjoys it. But what we don't see is after that, he doesn't have even strength to brush his teeth that night. Sometimes he pees in a bottle because he don't have the strength to walk to the tree, behind the tree, to go do that, right? And when he started explaining things to me, and like he went to the welfare office the other day, right? He pushed himself to do that. And then when we got home, and then he said, yeah, I get like that was a lot of energy that he had, because
well, I tried to drive the truck.
No, yeah, but just to get up and get, that's why I tell you too, like, he can't do fire drills, right? Because he plans his stuff. Okay, like today I'm gonna chop wood because I really want to chop wood. Today I'm gonna go hike with Trin because I really want to do that. But he's got to make sure that the next 3 or 4 days he's not doing nothing, because he knows he has to recuperate, right? And so those are the little things that he has to go through. And I didn't realize until a few months ago that there's a lot of times where he doesn't even have the energy to brush his teeth, so Angel brings him stuff so he can brush his teeth right there, and I thought to myself, once he turned 18, it's not that I wasn't paying attention, it's just, I think us as parents, when their heart kids reach 18, we assume also that they're doing okay, right? Because I'm not there at his doctor's appointments, and I'm not there when he tells the doctor, okay, I can't do this anymore, I can't do that. Because when he comes back from the doctor, I go, how did it go? And I'm asking now physically, when do you have to go to surgery next? What's your pacemaker life, and all that. but I'm no longer in that part of his life where like Angel is, right? Where
Mhm.
I'm every
That's
day.
why I'm grateful for Angel.
I am
Angel
too.
being with him 24/7.
And it takes a lot. It takes a lot out of her because I know, I've been there. And it mentally and physically exhausts you. And she's balancing school
Mhm.
as well, you know, and and also doing, the cooking and cleaning and doing his cooking and cleaning, and stuff. And so I know what that comes with, and it's not easy. And it's not easy to be with a hard kid. So I'm grateful that she's even willing to do that,
Yeah.
and it's just hard, and so recently I found out that one of my friends who is actually a mother, and she's probably one of the oldest that we know of with her condition. She's in her 30s, I think. Um, she was trying to go for a possible transplant evaluation and stuff, and she just found out that the doctors had told her
I love it. It's,
they can't, if she was to go for a transplant, they don't think that she would survive the transplant surgery, right? And
we praying for Tita.
yeah,
She's beautiful person,
she has two kids.
and she and these two kids, and they're also part of my brat club. I love them both, and her husband is freaking awesome. One of the most humblest guys you ever gonna meet,
Yeah,
and he just loves to take care of his family and
yeah.
solid people.
So, she's processing all this information, and
We love you, Puna.
the sad part
We love you,
is,
Puna.
the sad part is, you don't you don't realize what, because if you look at her too, she looks normal. She has a job, she does all these
She's
things.
got a great job.
But even her, she tells me that the past couple years, she's not able to go into work as often. She's not able to do these physical things, you know. And so I knew for a while that she was as sick as she is. But even knowing that, like, I know how sick Keegan is, right? I know that at any minute, his heart could just stop. It could just stop because we've had so many kids in his 27 years that when they
Just
have
succumb to.
surgery, like, yeah, like he literally is playing with the kid one day, and the next day we hear the kid passed. And I'm just like, what are you talking about? Like, they were playing Tonka trucks yesterday, and you just hear that his heart just stopped, I'm just like, that's crazy. Or we've had a couple of kids, adults, that just fresh adults like Keegan, that went in for a minor common surgery, nothing complex. And during the surgery, they go into cardiac arrest and they die. It's like, wait a minute. I thought it wasn't complex. It wasn't, so even for him, even a cath, which is like, the doctors even say it's just a cath. It's just a cath, right? And even we say that it's just a cath. Compared to a full open heart surgery, it's just a cath. But for him, the risk of just a cath is so much more. And even not even having a cath, you know, he could just die. And he has epilepsy too. He has seizures all the time. He doesn't have the kind of seizures that he drops on the ground and you can see him. He has seizures while he's talking to us sometimes, walking around. And it's just moments where he feels like, he always explains it like, when you're coming down an elevator fast,
Yeah.
that few seconds of
Right.
adrenaline, that's his seizures. So he can be talking to us and he'll have a seizure, but he's so used to it now. But any one of those seizures could turn into a longer seizure. We had one of our heart kids. She didn't die of her heart condition. She died because she got seizures because of her heart condition. And one day from the Big Island, her seizures didn't stop. And so all her organs shut down. They couldn't get her back. And she stayed in Kapiolani for a couple days.
No,
And they
that's
had to pull the plug.
that's good because I seen you go through seizures.
Yeah, and that's the risk too. Anybody that has seizures, even if you have a seizure, you're diagnosed with any kind of seizure, there's the potential to have a seizure that doesn't stop, you know?
Wow.
And so all these other things that come along with our heart kids, you know, people just don't, unless you live the life, you can hear the stories, but it's more than just fixing your heart and seeing that you look okay, you know, and you look okay one minute and you're not okay the next minute, you know, like my daughter would go through that a lot with her periodic paralysis, right?
Mm-hmm.
She's not paralyzed, and the minute she's asked to do dishes, she stands up and she's like, I can't. My legs are not. Oh, yeah, sure, because you got to do dishes, right? Not realizing that as soon as she her muscles to stand up to do the dishes, that's when her muscles stop working, which is the nature of periodic paralysis and myotonia, right? But she went through that too. And so it's you know, it's made me think a lot too as a mother to Keegan now, being so old, that I can no longer judge from what I see of him. Because as a kid, as when he was a kid, I could because I was the one taking care of him. But now as an adult, I can no longer make those assumptions because I don't know what he's going through every day, you know? And so it's like I just have to trust in him, you know? And there's one thing with him, he's always pushed the limits as much as he can. And that's why when he sleeps, he's out. Like even from when he was a toddler, he would play and play and play until his heart just couldn't do it anymore. And then he'd be like, Mommy, I'm tired. Okay, why don't you take a nap? His naps, he's out because his body has to recuperate. You know, he can't do it. And you know, now he has arthritis. And like, I don't know if that has to do with a condition, if that's correlated with something, but
You want us to just 1 second. You want us to go put gas and come back? So by the time we come back,
I don't know how we're gonna do that.
we don't have any money for gas.
I mean, if we do, we're not gonna make our. Yeah, I.
Okay.
But I forgot what I was saying now.
Good.
I forgot what I was
But
saying.
he's sleeping. Yeah.
No, his arthritis.
Yeah.
So
Okay.
when the doctor checked his arthritis,
Mm-hmm.
they said his arthritis looks like arthritis of an 80-year-old. So not only is his heart overworking, and not only does he have seizures throughout the day, but his arthritis just to walk around. His arthritis is like he's an 80-year-old walking around. And I'm just like, I thought I was bad. When I was in my 30s, the doctor said my arthritis looked like a 50-year-old. But he's 27 and he looks like an 80-year-old.
Yeah.
That's like crazy to me. But yeah, there's so much more that I could tell you about living with heart condition. But that's just one. And I think like your story that we're going to go through, I think I could probably do a story on my end about living with special needs and caring for special needs kids. But anyway, this is probably a super long video. I hope that it teaches people, and I hope that people treat this as an educational video. You know, you watch educational videos about history, it's hour, 2 hours long. So I hope that this really helps somebody. And if there's a heart parent out there, and I know that my story has helped many heart parents, just know that they're not alone. Um, you know, I'm always available to reach out to. Um, and my son has reached out to a lot of people too. So I'm gonna be brave and I'm gonna put my number out here. You know, I mean, my number
Yes.
was everywhere, anywhere, anyway. But if you are
She's usually
going
the
through
go-to
this,
person.
if you're going through this, so you need, you know, somebody to talk to or questions, you know, you can feel free to call me. Area code 808-726-6232.
Yeah.
And I believe it's on the Instagram anyway. I mean, on the, oh no, maybe not on the YouTube. Yeah, I don't know. But I hope you can like and subscribe. And I think we have 10, 11, 11 I think now.
Oh yeah.
Because I
Oh,
think
gain two more.
the
All
guy
right.
that came to buy food, I think, oh, I don't know. Anyway, I get mixed up with our Kanaka Okazia. You can follow us on Instagram too, Kanaka Okazia.
Yeah.
But
So you can check out all our grinds, bro.
yeah,
Nah,
so
she pump all the grinds, boy.
that's all I have to say for this chapter, whatever.
Proud of you that you're able to get all that out. I hope it
without
helped.
without crying so much, huh?
I hope it helped. Did it help?
It did. It does to get things out.
I want to dedicate this to Keegan. He's just an amazing young man. From the first day I met him, but it was already in my heart. Because from the first day I met him, I heard the song that he wrote.
Yeah, I'll talk about that then in the next one.
Yeah, that Malika Dudley had sung in honor of him and whatnot, and then also to all the heart kids and people out there that deal with heart defects or any kind of serious medical issues.
Yeah.
We as a society, I think we have a responsibility to malama each other and to have empathy for people, because we never know what people going through, bro. You don't know what the next person going through. And myself, I've been guilty in the past of being rash to attack when I'm feeling attacked, and I find out later on, like, one of my first convictions, original convictions, I didn't know. I thought the guy was just some alcoholic guy. That's the way he was acting like that. And little did I know that he had just come out of a stroke, and so I caught a life sentence off of that beef right there.
Because you pled guilty, though, right?
Yeah.
You found out what was wrong with him, and you didn't even want the attorney to defend anything.
It was in the middle of trial. It was in the middle of the trial, and then it came out on the stand, and I was like, I felt so ashamed, that this kupuna, his kupuna age, that I had subjected him to the robbery. Didn't even know that, so we just gotta love people and get away from the madness, bro. I know from personal experience that when you do bad to people, but that shit will come back and haunt you for the rest of your life. That shit will follow you for the rest of your life. I still pray for that man, and I still seek forgiveness for what I done. So in honor of Keegan and all those Puna and all the people that is involved, go through heartaches like that, and then it just the Tofi's sister, Becca, Melanite. She get. You just found out recently that she.
Oh yeah, petty.
Petty, right? We love you guys. We support you guys. and we're here. And I still hoping that my wife will start her Aiko's Inspirations blog. I believe that she could be the Dear Anne of Hawaii, and where people can talk and allow their issues to be aired out, and she can help guide you because she's one serious empath, boy. She's a real empath.
I do still have the Eichel's Inspirations Facebook page.
Yeah.
I just don't have time.
No. We gotta find a way to make time. We love you guys. Peace, happiness, y'all. Love you guys. Next time. Aloha.